Hello everyone, good afternoon. My name is Jayla Hilton and today I will be presenting my analysis of the impact of COVID-19 on healthcare delivery models and the implications for advanced nursing practice. The COVID-19 pandemic triggered rapid and unprecedented transformation in healthcare delivery systems. In response to public health mandates, infection control measures, and overwhelming patient volumes, traditional in-person care models were quickly modified to ensure both safety and continuity of care. Telehealth platforms were implemented at an accelerated pace, allowing providers to deliver services remotely. At the same time, regulatory barriers were temporarily lifted to expand provider capacity and improve system responsiveness. For family nurse practitioners, these changes significantly altered patient access patterns, reimbursement structures, and scope of practice realities. As frontline primary care providers, FNPs were uniquely positioned to absorb increased demand while adapting the evolving care modalities. Although many of these adjustments were introduced as temporary emergency measures, they have produced lasting implications for advanced nursing practice and healthcare design. One of the most significant transformations during the pandemic was the rapid expansion of telehealth services. Virtual care platforms allowed providers to maintain continuity of care while minimizing the risk of viral transmission. For FNPs, telehealth supported chronic disease management, medication follow-up, behavioral health visits, and triage services. This demonstrated that many aspects of primary care can be delivered effectively outside of the traditional setting. Another major benefit was temporary regulatory flexibility. Many states relaxed collaborative agreement requirements and scope of practice restrictions to increase workforce capacity. These changes allowed APRNs to practice with greater autonomy and efficiency. Importantly, these were temporary waivers that provided real-world evidence that full practice authority for advanced practice nurses is both safe and effective. The pandemic highlighted the adaptability, leadership capacity, and clinical competence of APRNs in meeting community health needs. Despite these benefits, the transformation of care delivery also revealed significant challenges. The expansion of telehealth exposed a substantial digital divide. Rural communities, low-income populations, and elderly patients often lacked reliable broadband access or the technological literacy required to participate fully in virtual care. While telehealth improved access for many, it also risked widening existing health disparities. Workforce strain was another major concern. Advanced practice nurses experienced increased patient volumes, evolving protocols, moral distress related to resource allocation, and personal risk of infection. Sustained stress contributed to burnout, and psychological distress threatened long-term workforce stability. Ethically, these issues raise concerns related to justice, beneficence, and non-maleficence. Justice requires equitable access to care, yet limited digital infrastructure disproportionately affects vulnerable populations. Remote assessments may also limit comprehensive physical examination, requiring careful clinical judgment to ensure patient safety. Additionally, chronic provider burnout raises ethical concerns regarding professional competence and quality of care. Balancing patient needs with provider well-being remains a critical ethical consideration moving forward. The pandemic significantly expanded expectations for the family nurse practitioner role. FNPs were required to develop technological proficiency in telehealth platforms, remote monitoring tools, and digital documentation systems. Beyond clinical care, FNPs assumed greater responsibility in public health education, vaccination campaigns, and population-level risk mitigation. The temporary increase in autonomy during regulatory waivers demonstrated the profession's readiness for sustained scope of practice reform. The relevance of these changes is particularly significant in rural communities, including rural areas of Kentucky, where provider shortages and demographic barriers already limit access to care. Telehealth has the potential to reduce transportation barriers and increase specialty access. However, limited broadband infrastructure remains a major obstacle. In urban environments, high patient density and disproportionate pandemic impact among marginalized populations further exposed structure inequities. Whether practicing in rural or urban settings, FNPs must advocate for delivery models that address both technological infrastructure and social determinants of health. Sustaining the beneficial transformations of pandemic-era healthcare delivery requires strategic action. First, permanent telehealth reimbursement reform is essential. Without reimbursement parity and regulatory clarity, virtual care services may become financially unsustainable. Advanced practice nurses should engage in policy advocacy at both state and federal levels to preserve these gains. Second, investment in rural broadband infrastructure and digital literacy programs is necessary to prevent widening disparities. Collaboration among health systems, policymakers, and community organizations can expand technological access for vulnerable populations. Third, hybrid care models that integrate both in-person and virtual services should be standardized. This allows FNPs to determine the most appropriate modality based on clinical presentation while maintaining flexibility and continuity. Finally, workforce well-being must be prioritized. Structured mental health support, reasonable workload expectations, and leadership development initiatives are essential to sustaining the advanced practice workforce. Protecting provider well-being directly supports high quality and safe patient care. In summary, the COVID-19 pandemic catalyzed profound and lasting changes in healthcare delivery. Telehealth expansion, regulatory flexibility, and workforce adaptation reshaped how care is delivered and how advanced practice nurses function within health systems. For family nurse practitioners, these changes expanded autonomy, technological responsibility, and leadership opportunities. However, challenges related to digital inequities and workforce burnout threaten long-term sustainability. Moving forward, FNP leadership in policy advocacy, infrastructure development, and workforce protection will be essential to advancing equitable, resilient, and innovative healthcare systems. To generate further discussion, I would like to leave you with these two questions. Number 1. Should federal and state policymakers make pandemic-era scope of practice expansions permanent to strengthen primary care capacity, particularly in rural communities? Second, how can advanced practice nurses advocate for telehealth sustainability while simultaneously addressing digital inequities facing vulnerable populations? These are my references that I used for this presentation. Thank you all. Have a good day.